Chromium picolinate, biotin, and sodium bicarbonate combination as a dietary supplement in the treatment of type 2 diabetes mellitus. Type 2 diabetes mellitus is characterized by hyperglycemia due to the insulin's resistance. The importance of glycemic control for prevention of vascular complications demands the need to promote accessible and safe treatments, among others, in the form of scientifically proven nutritional supplements. Previous studies have suggested bicarbonate-rich mineral water alter blood metabolites and gut microbiome, which was beneficial effects in patients with T2DM. Likewise, chromium picolinate and biotin have shown usefulness in glycemic control. Our hypothesis is that in supplementation with chromium picolinate, biotin, and sodium bicarbonate benefits glucose metabolism in patients with type 2 diabetes mellitus. We plan and supervise the execution of a crossover randomized double-blind placebo-controlled study of patients that was conducted in Diabetes Clinic of the Endocrinology Service of the University Hospital Dr. Jose Luterio Gonzalez of the Autonomous University of Nuevo León in Monterrey. The inclusion criteria were patients which, despite their treatment, had not achieved adequate control and that HbA1c did not exceed 10%. Patient follow-ups during the study include a day 0 baseline visit and 6 more visits over the next 6 months, and the crossover treatment was at 3 months. 47 of the original 75 patients completed the trial. Regarding the baseline characteristics, 53% of the participants were male and the mean age was 55. When comparing the changes that occur after both interventions, we observed that the HbA1c in the active ingredient group decreased 0.50% and in the placebo increased 0.12%. On the other hand, when comparing the proportion of patients who had an increase in their HbA1c against those who did not have any change or an increase, the level of difference between the groups of proportion increased. Active principal group with 51% versus placebo group 34%. Then we subdivide both groups according to their HbA1c level before the intervention and compare the participants with HbA1c less than 9 versus equal or more than 9. The placebo group has an increase of 0.15 and the reduction of the active ingredients was 0.68. In conclusion, we observed that the supplementation with chromium picolinate, biotin, and sodium bicarbonate decreased HbA1c in 3 months compared to the placebo group in which there was an increase, but with a tendency in the statistical analysis. We believe that this could be due to 2 reasons. The size of our sample due to the large percentage of participants who drop out of the study, or because the treatment period to observe a greater difference should have been longer.